What are my options if I want to change the shape of my nose? I'm Dr. Angela Sturm. I'm a double board certified facial plastic surgeon in Houston, Texas, and I specialize in rhinoplasty. So if you are not crazy about the way that your nose looks, there are some options to try to improve the appearance, and not all of them are surgery. You can start with something very simple like a liquid rhinoplasty. And what a liquid rhinoplasty is using fillers, and it's usually a hyaluronic acid filler that is injected on the nose, inside the nose, to create a more refined appearance. Best way to use it really is if you have a bump, you can fill above the bump and below the bump to help try to make that a straight profile. You can use fillers to lift the tip, to support the tip if you have a droopy tip, which can make it look more refined, can make it look more feminine, and then it works really well if your nose is a little bit crooked or you have places where it's more indented, to help fill those out to make the nose look more smooth and even from the front and from the profile. So that's nice subtle ways to change the nose. The tip and the injections around the tip can be a little bit more dramatic. You can have a bigger change with the nose. The pros of a liquid rhinoplasty are you can do them in office with just some numbing cream. It's very simple. You may have a bruise, but usually not. It's something you could do before an event and give yourself a week or so and you will be good to go. Cons are, if you do this, you really need to find someone that's an expert injector, preferably a facial plastic surgeon or a plastic surgeon. There are some amazing dermatologists as well, but it is a more delicate area that has a lot of vascularity, and so it's a place you really have to be comfortable with and careful with injecting because it has a higher risk. It is a place that does tend to hold on to filler for longer. I've found filler that has been there over a year, maybe even 2 years longer, because you don't move your nose, and so it doesn't go away fast like it does in the lips or somewhere else. But that means if you don't love it, it's maybe there for a little bit longer. If you do this and you decide that you want to do surgery, you do have to have it dissolved. And even after dissolving it, I've found filler, because dissolving is a bit of an art itself, and you don't totally know that it's gone unless you use something like an ultrasound, and even then there still may be some that's left there. Another con would be it's not permanent, so it doesn't stay forever. It lasts for about a year, but that depends on the kind of filler that is used. Like I said, it can last longer, but there's a bunch of different kinds of fillers that the injector can use. So if you want it to last longer, it won't last forever, but if you do this and then decide you want surgery, then you do have to get rid of it. So there's pros and cons of liquid rhinoplasty. I've had plenty of patients that have done the liquid rhinoplasty, really liked it, and then decided they wanted to do a rhinoplasty. So that's a nice way to try it out. Make sure that's something that you like and like the way that it looks. Next option would be threads for the nose. So what are threads for the nose? These are dissolvable. It's kind of what it sounds like. They look sort of like fishing wire, but a bit bigger, that are inserted into the nose, and they work very much like filler. It helps stimulate collagen in the places that they're put, and so you're adding volume wherever these are. They can be put into the tip to help support the tip, give you more rotation, more projection if you have a droopy tip, just meaning it can turn it up or pull it out a little bit if the tip points down. You can use it along the dorsum or the profile to help smooth that out. Pros would be it's not permanent, and so it's a way to test it out. A little bit safer as far as vascularity goes because you're not injecting this, you're placing something. Cons would be this is more of a procedure than just injecting filler, and so it could be a little bit more uncomfortable, but they would need to numb you up really well, and the nose is a very sensitive place. Cons would be too, if you go to have surgery after this. I have done surgery on people that have had these inserted, and you can have more scar tissue, and the soft tissue is a bit thicker, and so if you're wanting to make your nose look slimmer and more refined, that can be a challenge if you're going to have surgery later, because I can't really change the soft tissue too much without compromising your skin. Also, I would want someone that is really good at doing this to do this to my nose, because it takes some skill. Other options for changing the shape of your nose is rhinoplasty. So that just means it's a surgery that changes the shape of your nose to what you want it to be from where you are. I do this under general anesthesia. Some people will do it under IV sedation. This depends on your surgeon and the way that they want to do this and what they feel comfortable doing. I'm most comfortable doing it under general anesthesia. I feel like it's safer. Your airway is protected. You are going to be absolutely comfortable through the whole procedure. I feel very strongly that I don't want to cut corners or save any costs to compromise your comfort, because if you're comfortable, I'm comfortable, and I'll be able to do a much better job. This can be done open or closed. I do most of mine open unless it is completely functional, where you have a tiny little incision under this middle part that we call the columella. And then depending on what you're wanting, I will shape kind of like a sculpture, the bones and the cartilages, to make it look the way that we want. I can use your own septal cartilage, meaning the divider between the two sides on the inside. There's cartilage there that I can harvest to make the nose look the way that we want it to look. Other cartilages can be rib. I use donated rib the most because this is irradiated, it is tested for everything, and your body reacts to it exactly like your own rib. And you don't have to have the incision or pain of taking your rib. And I use this for people that have had surgery before, have a very crooked nose, have thicker skin, or just a heavier nose, because I need a little bit more structure to that cartilage to get it to do the way that I want it to behave. The next way that you could change your nose is a revision rhinoplasty, and this just means you've had a rhinoplasty before and you're going for another surgery to get it to look the way that you want it to look. This is a complicated surgery. It's something that I absolutely would look for somebody that does this all the time, because it is challenging. The people that do it, we love it because it is a challenge, but it's not something. If I was a patient, I would not want someone that does this and does a bunch of other things too, because it is very, very detailed. The normal anatomy has been changed from the first time. You may or may not have any cartilage in your septum or other places to take, and so we may have to automatically go to using the donated rib, which I use a lot, obviously. And there will be scar tissue. Even if you went to the best surgeon in the world doing rhinoplasty, and they're absolutely amazing, and there's so many out there, it's just surgery, and so it causes scar tissue. So that just makes the surgery a little bit more complicated, that we have to take our time, have to go slowly, make sure that the dissection is done carefully and properly. And getting things exactly the way that we want sometimes takes a little bit longer, and knowing, depending on how many surgeries you've had, our goal may be improvement and be hard to achieve. We can never achieve perfection, but we strive for it, in every surgery, but that's something that I have a good conversation with the patient about, of what I think is realistic and what I think we can achieve with each surgery. It's not a decision anyone undertakes lightly, surgeon or patient, just because it is a little bit more complicated. But with the right surgeon, you're able to get a really nice result and be able to get to the place that you want to be. And those are a lot of different ways that you can address things about your nose that maybe you are not as crazy about. That includes surgery and non-surgical, because surgery is not for everyone. And if you have other questions or want a personalized consultation, you can reach me at www.drangela.sturm.com, the socials at Dr. Angela Sturm.